disorders, viruses that you might not really have much details about them, but then there are a lot of things, but they are going on in our bodies. And today's topic for discussion is hemophilia, a bleeding disorder. Now, as part of improving the lives of people living with a bleeding disorder, which is hemophilia, yesterday was World Hemophilia Day, okay, and we are going to delve into the conversation. And we also have a mother who has a child suffering from hemophilia. We have a patient as well in the house today. And so before I introduce the mother who has a child with hemophilia and the patients, we are going to talk with Dr. Nana Agyeiwah Awuku, who is a senior specialist hematologist, University of Ghana Medical Center. Good morning, Doc. Right, and Mr. Martin Boakye, President and founder of Ghana Hemophilia Society. Good morning.
Good morning, ma'am.
How are you?
Good.
Right. So yesterday was World Hemophilia Day. Tell us about how yesterday went before we get into hemophilia itself, Doc.
Okay, so like you rightly said, yesterday was World Hemophilia Day. So in Ghana, we created a lot of awareness about hemophilia. So what we did as healthcare professional and also at Ghana Hemophilia Society was to do radio interviews, TV interviews, to create awareness of hemophilia around the country. So basically that's what we did for yesterday.
Okay, right. So, yeah, Mr. Boakye.
Yes.
Yesterday was World Hemophilia Day.
Exactly.
Yes, so like Doc said, basically awareness being created through media.
Yes,
and also, what other things were done?
Yeah, for almost all the satellite stations you have in Ghana, we have about 10, we went to radio and TV to make publicity of the disease and the condition. We mounted banners throughout the country, distributed flyers. As a way of getting the message out to the people, general public. So that's basically what we're doing. When we do that, the intention is that those who get the message will run to the medical centers and get checked.
Exactly.
And then begin the road to treatment.
Right, okay. So now it's time for me to introduce my other guests. And so the mother of a, who has a child suffering from this bleeding disorder. Good morning, Madam Janet. How are you? Right, and then we have a patient also suffering from hemophilia, Gilbert Awuitor. Good morning, Gilbert.
Good morning.
I hope you're okay. Oh, Jinjamuka Kama me, why? Are you fine this morning?
Yes, miss.
You're fine. Okay, now let me start with you, Doc. Tell us what hemophilia is. I mean, I've mentioned that it's a bleeding disorder, but give us details of what exactly it is.
Okay. So hemophilia is an inherited bleeding disorder in which the blood does not clot properly.
Okay.
So normally the body produces proteins known as clotting factors. There are about 13 of them, and they work together to help the blood to clot. So when we have a cut, or we go for surgery and there's bleeding, then these proteins will help the blood to clot so that we don't bleed out. And hemophilia, there are some of the proteins that are missing, or they are in very reduced quantities. So then it means that the blood cannot clot properly. And the common types of hemophilia that we have, the two types that we have are hemophilia A and hemophilia B. So in hemophilia A, a different kind factor, clotting factor 8 is missing. Hemophilia B, clotting factor 9 is missing. So then the blood is not able to clot properly when there is an injury. And even sometimes, so very insignificant injuries. So injuries that ordinarily you wouldn't pay attention to, like you're walking and your leg hits a table.
There's a small scratch.
But then in a person with hemophilia, the person will bleed into the joint, where someone who does not have hemophilia will not bleed. So it may appear spontaneous, but it's just because the injury is very insignificant. And so your attention is not drawn to it, and then they bleed because they are missing clotting factors.
But it's inherited.
It's an inherited disorder. And it's usually, so there are genes that gives instructions to the body to produce these clotting factor. there's a change or mutation in the gene, so you are not able to produce adequate amounts of the clotting factor to help the blood to clot.
Right, okay. Now let me come to you, Mr. Boakye. Now tell us about the current state of cases of hemophilia here in Ghana and the awareness of it. Earlier you mentioned, you know, as part of celebration yesterday through radio, TV, and just sharing of flyers and then all that. But tell us about the current state, or even if you can give us some statistics to prove all that as well.
The whole movement about hemophilia care in Ghana started way back in 2009 when I lost my son way back a couple of years before. When I had my second son, I had the same symptoms on circumcision, so I decided to take him out for checkup because then the doctor said they believe it was a case called hemophilia, but they are not sure because there was no treatment in Ghana. So I took him to the US and he was diagnosed to be hemophilic. So I came back to Ghana and I said, no, there must be many more such cases in Ghana.
In Ghana.
So why don't I try and help many others? And besides that, I got some support from the US, some lady called Lori Kelly. She said, no, Martin, go so that we can help other people with hemophilia. So we started 2009 and I got the support of medical personnel from Kolibu and Konfanochi who teamed up with the society. We did so much education around the country and then the awareness started coming. So we started from one, that is my son.
Right.
And as I speak, fast forward, we have around 480 patients of hemophilia in Ghana.
480?
480, in fact, many more. Many more because there are many that have come forward and sometimes we have difficulty in logistics for diagnosis. So they will come and maybe go, but there's more than 500 that they will have come forward and some have gone. But on a database, diagnosed and on a database around 480 patients. Yes.
Wow. Let me come to you, Gilbert. Tell us about how you were diagnosed. How did you get to know you were hemophilic?
Well, initially, I used to bleed in my joints and then sometimes gum bleeding. But actually, we didn't know anything about hemophilia. So,
How old were you?
Well, it started when I was a child.
Oh, okay.
So in 2013, I had a fall and I bled into my knee joint. So that's when I was diagnosed as hemophilia.
Okay, let me come to you, Madam Janet. Your experience first knowing that your child is hemophilic. Tell us about that experience.
A point of correction, I have two sons who are hemophilic.
So how many children do you have?
I have three, but I have two boys. They are all hemophilic.
And they both are hemophilic?
Yes.
Okay.
When I gave birth to my first son, that was 2003. That was when a nurse came to the house, as a midwife came to circumcise my son. And then he bled to the extent that we have to take him to Kolibu. During that time, there was no awareness of hemophilia. So the doctors did all that they could to stop the blood, but the blood couldn't stop. But they were able to do their best until they gave him blood and other things to sustain him. I nearly lost my son, but by the grace of God, he survived. And the bleeding stopped in 2 weeks.
2 weeks?
2 weeks. It wasn't easy, but I thank God for the Hemophilia Society of Ghana.
Yeah.
Because they came to Ghana to bring hope to our children. Because during that time, people were saying that it is a spiritual attack and so on. There was no awareness.
Which is so common for Ghanaians. It's something that we commonly do.
Yes. So that is when my mother told me that our grandfather has boys, but whenever there's a little cut, because there was no medicine and awareness, the children bleed to death. That's my uncles, they bleed to death. So it is very difficult as a mother to have such children around you.
Wow. We'll definitely come back to that for you to give us some more details, but let me come to you, Doc. So how's hemophilia diagnosed?
Okay, so usually, like they both said, the patients will have symptoms. Because of the way it is inherited, it's very common in males. Females can have hemophilia, but it's rare. It's not common to have
So
females.
it's more with males.
Because the gene that produces the clotting factor is on the chromosome X. And males have only one chromosome X, whilst females have two. So even if, for a female, even if one X chromosome is affected, the other one is there to balance it, to give a buffer. But males have only one. They have X and Y. So if the gene on the X is affected, they don't have any buffer. So it's commoner in males. So most of the time, one of the commonest presenting symptoms in very early childhood is circumcision. So we all know most males are circumcised around the world. And it's very early, like 1 week, within 3 months they are circumcised. And when the circumcision happens, they bleed. Because their body cannot produce the clotting factor to stop the bleeding. They bleed out. Before, children were bleeding out to death. So they bleed, and it's one of the things. Other times, so when they are learning, when they go a little bit older and they're learning how to crawl, you see bumps and bruises on their skin. That's the blood clot that has formed a collection, what we call a hematoma on their skin. So you see bumps and bruises on their skin. As they start to walk, they bleed into their joints. They have gum bleeds, which is difficult to control. Sometimes they have nosebleeds, which is difficult to control. When they're losing their teeth, a tooth comes out and they bleed excessively. Children lose their teeth all the time, but because there is a deficiency or absence of these clotting factors. So those are the things that will prompt someone to go into the hospital because the child has been bleeding so much. And once they come into the hospital, we take a history, we ask, like they said, their family, the males bleed a lot. So you see that in some families, they'll say, oh, when you give birth to a male, don't circumcise them. Because they'd had previous children in which they circumcised these kids and they passed away. So let's not circumcise our males because they don't know what it is and they don't want to have another death. So they will not circumcise them. So these are the symptoms that they come into the hospital with. So once they come in and we do laboratory tests, then it will help point us to which type of hemophilia the kids have.
I'm actually wondering how some people or some parents who have children who experience these in the rural areas are able to contain such situations.
Exactly. So, in Ghana, a lot of attributes are made to it. They'll say it's a spiritual attack.
Yes, like Madame
or
say.
A parent has gone to do something and it's a form of punishment. And because it runs in families, then they can say that somebody's great-grandmother or grandfather went to do something. So it's a punishment for the successive generations. Because it's genetic and it's inherited, you find it in their males, even though occasionally some individuals may not have a family history, so you don't have that male is the first person presenting with that. But most of the time, you have family running in families. A lot of times, it's attributed to so many other things, which is not. That's why we are creating this awareness so that when someone has a child who is experiencing these symptoms, they can come into the hospital, we can diagnose and we can treat them.
Is there any way that in the early stages of after you've given birth to a child, you run tests for every single child to make sure that the child could not have inherited something like that?
These things. So, okay, to run such public health programs, you need, there are certain criteria that the number of people affected and how easily diagnosed it is. So hemophilia is not so common. So usually we want to create the awareness so that when you notice these symptoms, then you come in. Because it's not so common, it's difficult to say we are screening every child that is born. But what we can do is educate everybody so that everybody can look out for these and come into the hospital so we diagnose them. Okay, let me come to you, Mr. Boakye. Now, earlier you mentioned that around 480 people are currently suffering from hemophilia here.
Diagnosed
with hemophilia here in Ghana.
Yeah.
And so how are people suffering from these? What are some of the challenges that they face? Can you outline them for us?
Yeah, good question. Let me go one step back to what Doctor just said.
Okay.
I know for a fact that in advanced countries, where they have a lot of facilities and then medications around, they do test most of the male child when they are delivered.
Okay.
Just to make sure they don't have the disease, hemophilia. So that is just to add, yes. But it's now, yes, and it is difficult because now, I'm sure we'll come to it. There are still challenges in Ghana that we must overcome in terms of this diagnosis and care. So we are not there yet.
I pray we get there. I pray we get there soon.
Yeah. The parents or the challenges for hemophilia care is multi-dimensional because the parent has a lot of work to do, just like Madam Janet mentioned. I mean, assuming you don't have any idea what hemophilia is and they are in the rural areas, like the rural areas, just like we asked the first time, they will do this concoction, you know, this herbal concoction, and they say, come, let me stretch your leg, and then you apply this herbal thing. That never work. So very soon, when the boy is around 10 years and beyond, then you see standing by the roadside, the knee is bent and the knee is swollen, and then they call it, let's say, Awuitor or whatever they call it. There's a name for it, an English name for it. Yes, whatever. Exactly, rheumatism, exactly. So then you see the child has problems because sometimes the child wakes up, like my son experienced. I'm a parent of a patient. He wakes up in the morning and all you see is the thigh is swollen. They call it spontaneous bleed. The arm is swollen. He wakes up in the morning, then there's blood on the pillow and the bed sheet. It can spontaneously bleed from everywhere. Like doctor said, when they begin to walk, any little fall, there's a bump, there's swelling, bruises everywhere. My first son who passed, for instance, was so challenging that at a certain point when he was 4 before he passed, he was almost like all the joints were stiff. And that's what eventually happens when in the villages or where they don't have access to the medication. The continuous bleed, swollen, bleed, stop, sweet, stop. By the time the boy is around 8, 9, 10, then the joints are destroyed. Then you see their hand go like that. You see everywhere go like that. That is how this. Eventually, when there's no medication and you do try and error, like I'm saying, then the joints are destroyed by the age of 10.
So, Boakye, you're going to continue that. And so, viewers, still on the topic of hemophilia and with what Boakye is describing as some of the challenges that these patients go through being hemophilic, we are going to show some pictures. And so, viewers' discretion is advised on this one. Mr. Boakye,
yes.
Let's continue.
So that is it. So the challenges is for the boy, how he will be happy as a young kid to grow. Like boys want to play, how they want to play, they cannot play. They go to school. School is not continuous. Like every now and then they must stay home, take care of a bleed. Sometimes in their urine is blood. There's a current case at Kolebu, one of our parents, very handsome guy. Recently, he was admitted at Kolebu. He's bleeding blood all the time. Others have challenges, and sometimes it leads to fatality, fall. Once intracranial is in the brain, die. Wow. Then the mother or the father also has the same challenges, where to go to get medication. You can't sleep because your boy is always in the house. You can't go to school, then moving around. And in fact, it leads to even divorce cases. Several divorce cases are because sometimes most men are guilty. The men will think that the women are something. It leads to a lot of divorce. Most of the women in the society, when you call them, because the fathers think that the mothers are something, or there's something from the family.
But you men, why are you like that?
I don't know.
Why are you always like this?
I don't know. I don't know. So the challenges is from everywhere. The doctors have their own challenges. The patients come, and then today you give him the medicine injection, then he comes 3 days later and they say, but you gave injection yesterday, and then so doctors have to find an innovative way of getting the patient relief. So it's very challenging.
It's very challenging. Let me come to you, Gilbert. Are you okay? You keep on, your head is bent. I can see you are, he's fine, he's fine. Now, Gilbert, tell us about the challenges that you personally face on a daily basis. Tell us about that.
The challenges, normally I bleed in the joints and they are very painful. And I find it difficult whenever I breathe like that. I find it difficult to go out. Sometimes.
So you can't move your limbs at all.
Yes. Sometimes I'm not able to go to school, and so on. And mostly I don't have to. Like, sorry. When I don't normally go out with friends because when I go out, maybe I'll go and bleed, and then
so
I'll find it
is it something that happens randomly, or you do a rigorous activity?
Sometimes it happens randomly, without any vigorous activity. It happens, and sometimes when I do vigorous activities too, it happens.
Wow. Let me come to you, Madam Janet. Tell us about how you manage the emotional and the practical aspects of taking care of your children, your two boys.
Yes, yeah. Whenever I'm talking about this issue, I become so emotional. Because it is a very painful experience as a mother to be going through. I didn't give birth to the child alone. I gave birth with a man. It's unfortunate that whenever it happens, the burden comes on us, the women. And then we go through a lot. And such children also need a lot of attention. If you don't give them attention, then you lose the child. My firstborn is almost 20 years now. He's supposed to be in the university right now, but he's in SHS2. You see? So it is not easy to manage such a hemophilia. It is not easy. And if you don't take care, you become a stigma in the society. And then the teachers too, most of them, they don't know anything. You see a science teacher in the school who doesn't know anything about hemophilia. And he doesn't understand the reason why you should beat a child. Kolebu will be giving us letters to the schools all the time. You present the letters to them, but yet they still want to beat the child. And these children too...
Regardless of the doctor's report?
Yes. And then there are times you have to go there. You know, there are times I cry. You see?
Is it that the school expects the children to act in a certain way, but they are unable to?
The reason, the main reason is that maybe they are punishing everyone, and they want to punish your child, and you say no. You see? Most of the time, the headmasters and the headmistresses, they understand this kind of things. But the teachers, you know, they don't understand the reason why. And because of what Gilbert was talking about, him not doing, my children don't do outside activities. They are always indoors. You see? And because of that, they are not this kind of children that do bad things. Yes, but still you see a teacher trying to tag your child, and it makes me so emotional. And I wish this kind of information would go to the schools, because there was a time I was telling our president that I wish these children have their own schools.
Oh, yeah.
Because with that one, they will know how to manage.
They understand
somebody
everything.
like me, I wish my child could go to international school whereby maybe they will be catered for, but I can't afford. So I have to take him to ordinary school and make sure I go there frequently to make sure I monitor the child.
But it's rather unfortunate that you have to be going there frequently to monitor.
Yeah,
regardless of the reports that you keep on giving to teachers, that they can't be touched with.
So you see, I think it's a lot of education. That's why when we get these opportunities, it's about educating people. Because you see, if someone doesn't understand something or they do not know about something, then it's difficult for the person to react appropriately. So Ghana Society of Hemophilia, the Ghana Society of Hematology, which is made up of hematology healthcare professionals, we trying as much as possible to educate everybody, because once people know about it, then when we give these letters, when we, the parents talk to their educational institution, they can react appropriately because they don't know about it. Do you understand? It's a mother has come to say something. Sometimes they may take it as an overprotective parent trying to...
Who has just gone to the hospital to get a doctor's
trying to get the child out of punishment. Yeah. So we need to create the education. We need to create awareness so that people, they understand. And I believe that once the awareness is out there, then people can understand, and then we can manage our patients with hemophilia appropriately. Again, with the challenges, so we have a lot of social challenges, a lot of psychological challenges. And even when it comes to medical treatments, there's a lot of challenges. The gold standard of treatment is to replace this missing clotting factors with commercially prepared ones.
Okay.
That's the gold standard. And what normally we should do is to give it as often as we can. So usually between 2 to 3 times in a week. So that every time you have some of this missing protein circulating in the body to help with clotting. Unfortunately, in Ghana, we do not have the means or the funds to give this what we term prophylactic therapy. So we don't wait for the child to bleed. We infuse it. So in the Western world, they are
like a daily.
So usually it's between 2 to 3 times in a week. So 3 times in a week, you are infused with the clotting factor to help maintain the balance. But in Ghana, we can't do that. So we wait when there is a bleed, then we give it to stop the bleeding.
Is it that it wouldn't be enough?
It's expensive. We don't have enough to do that. So we have to wait to have a bleed, and then we educate our patients. So when at the slight notice of a bleed, they come in, and then we assess them, we give them the appropriate amount to stop the bleeding so that it doesn't worsen. Because like we had mentioned earlier, one of the major problems is joint health. Because there is a lot of bleeding into joints, so they get arthropathies and they can come in with various kinds of deformities. And it's one of the things that we want to prevent. And so in the Western world, hemophilia, patients with hemophilia and those without hemophilia have almost similar expected life expectancies.
Okay.
Because they get
it's available. The infusion is available.
They get it regularly, unfortunately. But I think that our patients with hemophilia, those that we have diagnosed, are generally doing well.
So what exactly are you doing?
Now, because through our major stakeholders, World Federation of Hemophilia, Roche Pharmaceuticals, and Novo Nordisk, all through the efforts of the Ghana Hemophilia Society and other healthcare professionals, we are able to give us free factor concentrates. So you don't pay for the factor concentrates. All hemophilia patients in Ghana do not have to pay for the medicine. Let me put it that way. Okay. You may have to pay for the hospital charges, but for the medicine itself, you don't buy it. It's free of charge. The Hemophilia Society, the medicines come to them. They distribute to the major treatment centers, which are Kolebutin Hospital and Konfanochi Hospital, as well as the satellite sites that we have, so that patients can go in there. Once they experience a bleed, a healthcare professional will see to them, assess, and determine how many days that you need it for. If they are going for surgery, we plan it so that we can give them the factor so that they do not bleed out on the operation table, so that we can plan and give them to have the balance so they can go in for their surgery and come out successfully. So that's what we are doing, able to give them treatment. Unfortunately, we are not where we want to be. And we are hoping that through this awareness, policymakers, those in high places, will help assist our stakeholders who are supporting us currently so that we can get enough of these factor concentrates to be able to give our patients prophylactically so that we don't have to wait for them to bleed before they come. Because sometimes some of them, they live far away from, they have to travel long hours to come into these treatment centers. And sometimes it's a hindrance because they'll say, oh, they don't have money. Or you tell them, come for 5 days for the treatment. They'll come 1, 2, by the 3rd day, they are doing okay. And they don't complete the treatment because coming every day is difficult.
It's another issue.
But if we are able to get to the point where we don't wait for them to bleed, but give them the medicine prophylaxically as and when, then it will improve their lifestyle, and all these deformities, all the other things associated will come to the barest minimum.
So on a regular, the treatment options available now, how long does it last?
No, so thankfully now we have a lot of, before we used to kind of ration factor, but now we have a lot of factor concentrates available. So once you have a bleed and you come in, you will get, so the number of days will depend on the type of bleed that you have. So when you come, the doctor will assess and decide that you are going to get 100% correction within 3 days or within 5 days. It depends on where the bleed is occurring. There are some that are life-threatening, like they can bleed into their brain and have a stroke. So if you have a brain bleed, then amount and the number of days will not be the same as someone who had a cut and it's not bleeding, or someone who had a bleed in their knee joint. So it depends on the type of bleed that would determine the duration. But once you come in, thankfully now we have a lot of factor concentrates, so you're able to get the appropriate treatment when you have a bleed.
Mr. What? Yeah, you.
Just a bit to what?
No problem. Yes, please.
This case of children, thank you very much for this. The children in schools is a problem throughout the country. So therefore, the society, every year we have a schedule. We go around almost every regional hospital in Ghana on our outreaches. When we go, we spend like 3-4 days where we do education. We go to one of us, my staff is the one over there. We go to hospitals, we go to schools, we go to churches, we do the education in the hospitals. Like in a regional hospital, before we go, we plan with Ghana Health Service. They give us authority to go to the region, and then we bring all the healthcare personnel, most of the healthcare personnel in the districts to the regional capital. So we bring together doctors, nurses, physiotherapists, and all that to one-stop shop, the regional hospital. Almost every year we do that, and we educate them. We have our team of experts from Kolebu and Konf Anoche that we take to all these regional capital for education. So now, unlike before, when my son and Awuitor, they didn't have any doctor who knew what was now. The doctors know what is hemophilia. At best, they can refer you to the closest treatment center, either Kolebu or Konf Anoche. But we do teach the schools, but they find it difficult to accept what we say. They shouldn't touch the kids when we go around. So that is the challenge that she was talking about. It is common among the regions about teachers not to harm.
Alternative forms of correction.
Exactly. Why can't they?
Yes, it's difficult for them.
It's work in progress.
Yes,
we just need to educate more.
Yes.
So it's work in progress. So you'll get there. Care of hemophilia has improved greatly.
Yes, yes.
So we'll get there.
Okay.
It's work in progress. So with the help of the media trying to educate people, we'll get there.
We'll get there.
So,
Gilbert. Okay.
So let me add one.
Sure.
Doctor mentioned the case about the drugs.
Yes.
She's right. Fortunately now, we have sufficient, even though I won't say it's all right, because if it's all right means that the 480 patients should all be on prophylaxis, which we can't do. But now we have some amount of the medicine that for those who show up, the difficulty here again is also on the patients. The hospitals have clinic days for the patients to come and take. They will examine them and see they need to have the injection. Sometimes they don't have any case, they don't show up.
They only show up when they
only show up when it's critical, and then they show up. However, if they will show up, like doctor said, they have some amount of medicine to give them injection and they go. But one day, as we go around and ramp up the numbers of patients, our target is around 3,000 patients in Ghana, because the statistics show that for every 10,000
of the population.
Okay, or in simple terms, for every 10,000 population, you have one person who is hemophilic.
Right.
Which means that in Ghana, we are looking to ramp in about 3,000 patients of hemophilia.
Wow.
Now, when we get there, or when we are midway, we have been advised, the society has been advised by the major stakeholder, the World Federation of Hemophilia. They said, Ghana Hemophilia Society, listen, when you get to 1,000 and 1,005, we may not be able to supply you sufficient donations for your patients. So every year, they advise us to get some collaboration with the government. The government must come in. In fact, the WFH's main target is for all the member countries to get the government involved. As we speak, government is not involved. The running of the society, the patients, the society, and the doctors. Because 2011, the society got accredited by the WFH. And accreditation means that now they can send drugs to the society, then we give to the hospitals. Without accreditation, we wouldn't be getting the drugs. I remember before the accreditation, I looked to source for drugs around the whole world. Then they'll give you small, and then that time they were giving on demand, they give you small. Now we have the drugs coming somehow continuously. But what we are doing is this. One day when we get to 1,000, 1,005, the WFH will tell you that we can't give you enough because many developing countries have the same challenge.
Yeah.
So now the society is liaising with the government. Last year we had a very wonderful outreach.
Okay.
One of our major stakeholders came. They supported us for about 3 months in town. We had meetings with the Minister for Health, Ghana Health Service, Kolebu CEO, Kofanochi CEO, and they are all on board. Now we have one more step to take, and then maybe the first step of the care, that's the treatment, diagnosis, will be taken by government. And that is what, because now, if a patient hears us and he says, let me go and check myself out. When you go to Kolebu Kofanochi, you need to have around 500 Ghana cedi before they will be diagnosed. And I can tell you on record that 95% of the patients that we mentioned on our database can't afford 500.
They can't afford it.
I am telling you. That's what our database shows at, and that's a challenge. Sometimes when we even call them for meetings, we need to give them transport to go back. Otherwise, they will not come. So we have made a lot of advocacy with government. Government is looking at the possibility. We are still, the board is looking at how to, they asked us to bring proposal. So at the first phase of treatment, diagnosis will be taken. Before
so you're putting together the proposal?
Okay. We get to government, and then the government will get involved in the drug importations.
Okay.
So this is where we are.
Okay, all right. That's great. Gilbert, what do you hope, or where do you hope that things would be different in relation to what you are going through currently?
Well, my hope is, as the president is saying, we need to get a lot of factors so that we get injected always, so that the bleedings that, or we don't bleed at all, and we can be active always, go to school, do our work, and then
live normally.
Yes.
Yeah. All right. Okay, Madam Janet, briefly before we go, what do you have to say?
I'll plead to the government to help us, because we really need help. We really need help. We need the medicines for the children, because without the medicine, our children cannot survive.
All right. Okay. So, Doc, final submission before we go briefly.
Okay. So, hemophilia is an inherited disease. It is not any spiritual attack. Once you get the symptoms, kindly report to the hospital. We'll diagnose, and then there's treatment available. There's a lot of hope available. There's treatment, there's counseling, and there are support groups. So you are not in this alone. Healthcare professionals, other patients, parents, a lot of other supporting stakeholders. So there's treatment available. Please just report to the hospitals, and please create awareness. Tell a friend to tell a friend, so that people know about it, and then together we can get hemophilia care to where we really want it to be.
Doc, thank you very much. Thank you very much.
Last comment.
Briefly.
You say that the theme for this year's Hemophilia Day is access for all. Access for all means that stopping bleeding is the global standard now. Okay. We don't want children to go through bleeding before they are rushed to hospital. So we want the message to go out there, like Doc said.
Okay.
Treatment, they must go out so that the bleeding stopped before it becomes a disaster.
Right, okay. Dr. Nana Agyeiwah Awuku, thank you. Mr. Martin Boakye, Madam Janet and Gilbert, thank you all so much for being here on Good Living segment. And so viewers, let's do our very best to go to the hospital to get checked. My name is Asieduwaa Akumia, and I did this with IB Ben Bako. And yes, thank you so much, Nutri Snacks. Thank you so much for sponsoring Prime Morning. And so get you some Nutri Snacks or digestive biscuits. It's very healthy, all right? See you same time tomorrow right here on Joy Prime TV. Thank you. Bye-bye.